1.1 FM and AM 1160. Good morning. Thanks so much for being with us here today on this Wednesday morning. You can watch our Heart Month segments with the folks from IRMC all this month on our Facebook page, and they'll also hook it up on IRMC's Facebook page as well as we get Heart Month underway. This morning we are visiting with Sara George, registered nurse, and with Michelle Richards, who is the value-based care specialist at IRMC, kicking off our Heart Health Month. Ladies, good morning.
Good morning.
It's good to have you both with us. Our conversation is brought to you by Marcus & Mack, a law firm representing injured people. I want to start with you, Michelle, and learn about what you do. What is a value-based care specialist?
Well, basically, what my job is that I provide education and work on continued follow-up for our congestive heart failure patients.
Mm-hmm.
Education is most important, we have found, with trying to have our patients be compliant with their care and to try to help prevent them from coming back and seeing us so frequently.
Yeah.
That's our main goal. Readmission is very high for the congestive heart failure patient. Actually, it is the highest for any of the diseases.
All right, so let's define congestive heart failure, because IRMC's just started a whole new program based upon CFH.
Yes.
Huh?
Well, congestive heart failure, it's a weakening of the heart muscle. And basically, patients, they fill up with fluids. They'll fill up with fluid in their lungs, in their legs, in their arms, and other organs of their body.
Mm-hmm.
So the idea is that through education, we stress weight management. We can offer scales to our patients, and what we try to encourage is that every morning when they get up, they weigh themselves. And if they're starting to gain a couple of pounds, that's a key indicator. I think I'm filling up with some fluid, and I might not be going in the right direction. So what happens is, with a lot of times with our patients, they don't do those type of checks. They don't get up and they don't weigh themselves. They don't kind of pay attention. They might be getting a little bit more short of breath than they had been, and they ignore those signs. And then what happens is they end up in a full-blown episode, and we get to see their lovely little faces back in the emergency room again, and they get to be ours. And we really like to keep them home and keep them healthy and managing their disease. So a lot of the education is the weight management. I can give our patients, we have like pill boxes. Medication management is also important. A lot of our patients, they're not always consistent with taking their medicine the way that they should. So again, education and signs and symptoms. So when we go back to the weight, I tell them, okay, if you gain 1 or 2 pounds, you need to start thinking, geez, something might be going on here. The next day you get back up, you gain another 1 or 2 pounds. I think I better call my doctor and say, hey, this is what's going on. This is what's happening. And a lot of the physicians, they actually have protocols so that when your patient is starting to show some signs and symptoms, they'll increase their medication and they'll put them on a protocol for so many days. And again, we can try to manage that at home as opposed to them just getting so far out of control with the disease, they have to be admitted to the hospital.
A lot of people drive down the road and they'll see the speed limit sign to the right that says speed limit 45, and they'll go 50 or 60. They'll ignore the sign. They'll see the stop sign. They'll blow right through the stop sign. And you want them to pay attention to the signs.
We do, and that's an excellent analogy. That's great. Yes, we do. We definitely want them to pay attention to the signs and be aware of them. A lot of the times the patients, I think they think, oh, I'm getting older. This is part of life. And not all the time. Your body is telling you when it's not feeling well, and we have to listen to it.
Yeah.
It's really important.
The congestive heart failure program at IRMC.
Yes.
How does it operate? What are the things that you do?
Basically, I come through and I look for our patients that are in there with heart failure, and I go in and just talk to them. see where they are in their disease process, how they're handling their disease process. And we work on education. Diet is also very important, especially they need to really be on a low sodium diet.
Hmm.
Again, that helps with the weight gain, with the water, the fluid retention, and that. So, we'll talk about that. Like I said, I'll ask them, do they have a scale? Can they use their scale? And if not, I have scales. I'll bring them up and we get them on the scale. We show them how to use the scale. And those might seem like very simple things, but sometimes the simplest things are sometimes the harder things to actually achieve. And the same with the pill boxes and that. I'll ask them about their meds and they might say to me, "Oh yeah, I have them in my little bottles or whatever." Well, I can give them a little pill box and we can manage that. The other part of my job that's really important is the follow-up. Once our patients go home, they've seen me every single day that they're there. We've built our relationship. We go over signs and symptoms and that. And I tell them, I'm going to be calling you.
Hmm.
And that's incredibly important for success as well.
Yeah.
Because every phone call, it just helps reinforce what we've already talked about
Hmm.
while we were in the hospital. So I can check on them and see how we're doing. And if they have questions, I'm there to try to help answer those questions.
Congestive heart failure is a scary word, a scary term,
Yes, it
and
is.
you hear that thing, and maybe you should be a little bit scared when you hear it, but it doesn't mean congestive heart failure. I'm done. That's a death sentence.
No,
I'm over.
no.
That's what you're all about, isn't it?
Yes, absolutely. And again, like I said, education is key. If patients in that, if they do recognize, okay, I have congestive heart failure, so I have to do some additional things. If they really work at it and they're compliant and they really work with the therapy and that, they can keep it managed. They can
Hmm.
keep it in tow. The problem is, like I said, a lot of patients do not. And just like your analogy, they ignore. They ignore the warning signs
Yeah.
and then we end up in the hospital and every episode that you end up in the hospital, it just becomes harder and harder the next time
Hmm.
to try to keep you home.
Well, it's interesting you say ignore the signs. Sara George is with us. She's an RN at IRMC. And Sara, when we talk about heart issues and Heart Health Month, one of the signs that's easy to ignore is, or a group of the signs, are the signs of stroke. Stroke is an offshoot of a heart condition, and it's a very scary term as well. And there are signs that we should be paying attention to there
Right.
too, right?
Right. Yes, you have to have a healthy heart to help decrease your risk of a stroke.
Hmm. So let's talk a little bit about what it is. We know the two types of stroke. We go over this every year, but it's worthy to do it again so people understand what we're talking about. When we use the term stroke, it's a broad term. Let's sort of narrow it down and define it a little better.
Okay, so a stroke sometimes is easily defined as a heart attack to the brain. So you're having decreased blood flow or lack of blood flow to a certain part of your brain. The first type is an ischemic stroke. An ischemic stroke is whenever you have a clot or plaque in one of the blood vessels of the brain that is blocking that blood flow. And then the second type is a hemorrhagic stroke. A hemorrhagic stroke happens whenever there is a rupture or a breakage in the blood vessel in your brain, causing bleeding in the brain.
Mm-hmm.
And then I also just want to mention a TIA, which is commonly known as a mini stroke. This is whenever you have the symptoms of a stroke just for a short amount of time, whether that be for minutes or hours, but they do go away, and you should not ignore signs of a TIA, as that usually leads to a larger stroke.
Yeah. All right, so let's talk about those signs. What should we be looking for? Or maybe if we're not actively looking for, when something does show up, what should trigger in our brains to say, I better get this looked into?
Okay, so most recently, the AHA, the American Heart Association, has adopted BFAST, the acronym, previously known as just FAST. So act fast whenever you're having signs of a stroke. So B stands for balance if you're feeling off balance or you have loss of coordination. E stands for eyes. So if you're having vision loss, double vision, blurred vision. F stands for face, facial droop on one side. A stands for arm. So if you're having weakness, numbness, tingling in one arm or the other, or if you're not able to move your arm at all. S stands for speech. So if you're having slurred speech, stuttered speech, if you're unable to speak in complete sentences, or sometimes they're not able to understand what you're saying. Mm-hmm. And then lastly, T is time. We always say time lost is brain loss.
Yeah. So those are the signs to look out for.
Yes.
Frequently, it requires somebody with us to notice those things. They might notice it before we do.
Right.
Yeah.
So I just encourage everyone, if your loved one or even if you're out in public, to call 911 immediately, as seconds do matter. You know, that's blood flow cut off in your brain.
That's the first thing to do, isn't it? Call 911.
Yes, call 911 and get you to the emergency room. They can alert us in the field, and we can know that you're coming in as a stroke, and we can clear that CAT scan machine, and we can have the stroke team there and ready and waiting for you.
Mm-hmm. There can be an amazing difference in the outcome of a stroke because of that timeliness factor. Very
true, Todd, very true. So we actually have a medication. It's called TPA. You have to be a certain candidate for that. And that's it breaks up that clot in your brain. Now, there's only a certain time frame that we can give that medication. Mm-hmm. So that's another reason that we really encourage calling at the very soonest that you can.
Yeah. All right. So we're trying to prevent stroke here, or at least react to stroke as quickly as we can.
Yes.
Many of the effects of stroke, if they are treated and it's a successful treatment, can be reversed. Rehab is a very important part of this whole formula too, isn't it?
Yes, it is. And we have rehab facility within IRMC, and we actually have a rehab unit where you can be discharged to within the hospital after you suffer a stroke. And you're an inpatient, you can go to rehab within IRMC.
IRMC has made a great effort over the last 5 or 10 years to up its game in the stroke world, and it's resulted in positive recognition and has really been a difference maker for IRMC, isn't it?
Yes, we are a primary stroke center, and we are recognized by the AHA.
Yeah, and so that is something that is very helpful for people to remember when it comes to treating the stroke, is that you get yourself off to IRMC and as quickly as you can, you get your treatment. There's a very good chance that what could have been a catastrophe is not so much, and that your life can return to normal.
Yes, and that helps decrease these disabling effects. Mm-hmm. The quicker that you get help, and we can get you rehab, because stroke is the #1 disabling disease in the nation.
That's amazing. All right, so what's Wear Red Day? Tell me about that.
Wear Red Day is this Friday, Todd. As we know, it is American Heart Month, and it's nationally recognized this Friday, February 4th, to wear red, to raise awareness for women's cardiovascular disease and stroke risk. So cardiovascular disease is actually the #1 killer in women.
Oh, yeah.
So wear your red. I don't know if you watched the Pens last night, but they had their red ties on already for American Heart Month. So we just encourage you to wear your red to raise awareness for women this Friday.
On Friday, absolutely. And it's interesting and important that you point out that women are the focus on Friday, because women tend to, and you do this, women tend to ignore signs of stroke more than men do, from what I understand.
Yes, and heart disease. Todd.
Oh, yeah.
Yes, because they have sometimes different symptoms. Whenever you picture someone having a heart attack, you don't necessarily picture a woman. Mm-hmm. We most usually picture a man. So just be aware that those loved ones in your life, they can also be having cardiovascular disease or a stroke.
Sara George, thank you so much.
Thank you.
Michelle Richards, thank you as well.
Thank you.
It is the first of our Heart Month installments here this morning on Indiana in the Morning. We kicked it off well, I think. It is the voice of Indiana County, WCCS, 101.1 FM and AM 1160.